How do you know if the estrogen and other products are working? How is dosage monitored?
So very simple. We don't measure blood tests or urine tests because it's never been shown to correlate with symptom relief, nor is it effective in finding what's actually available in your tissue. So we treat you based on your symptoms. So if you have improvement in your symptoms and you're minimizing any unwanted side effects, most common side effects I should mention are some transient breast tenderness, some irregular spotting and bleeding, particularly in the first 6 months. Those are very, very common side effects. Once we get over the hump of the first couple of months, they tend to go away. So we minimize side effects, maximize your symptom relief. And so if you're not having a lot of symptom relief within 4 to 6 weeks, you need to speak up. And I would say within 2 weeks, if in 2 weeks you don't have even some modest, tiny improvement, let us know. Don't sit and suffer, because you start low and we build up. So that's how we decide the dosing.
Yep. And here's another one. My gynecologist will not prescribe HRT until I have an ultrasound to measure the lining of the uterus, so he will have a baseline image. Is this really necessary?
No, it's actually frowned upon. It's junk science. There is not one single recommendation out there. We do not follow women with endometrial stripe measurements. That is only reserved for a woman who is having abnormal bleeding outside of the 6 month to 12-month window of being on hormone therapy, or for other reasons, but definitely not for the initiation of hormone therapy, not by any means.
I had to quit strength training because of recurrent joint pain, elbows and hips. Could HRT help control these symptoms? I'm thinking I may need to have my dosage increased. I'm not seeing much symptom relief, joint sleep, hair loss.
Yes, absolutely. It's incredible, women with joint pain, when they are on the right dose of estrogen, how profoundly they can have profound relief, and then they can resume all of those other healthy activities.
I can attest to that from personal experience as well.
Yeah, me too.
Can I use birth control instead of MHT for the rest of my life?
Not ideal, no. So, ideally, it's great for perimenopause, but there's frankly no reason, once you are past the average age of menopause, and certainly by the age of 55, for you to just switch to menopausal hormone therapy. One, it's a much lower dose, still giving you all the benefits with a lower risk, because as we age, synthetic oral estrogen and synthetic progestins, remember that's different. They're synthetic. That's just what the birth control pill is. If we gave women high enough doses of bioidentical menopausal hormone therapy to prevent ovulation and be there for birth control, they wouldn't be able to tolerate it, because we'd have to give them such higher doses. That's why there's synthetic forms. So as you age, there's a much better safety profile to just being on menopausal hormone therapy than the birth control pill at that point.